you judges and AIOS for this opportunity. So I'll be presenting on the GLOW study, which is Gloport utilization in the real world. So no financial interest in this presentation. So in vitreoretinal surgery, you require multiple instruments and you frequently need to exchange them as the case gets more and more complex. You require change between, you need a frequent instrument exchange and a fast instrument exchange, especially when there is bleeding and all intraoperatively. So when you need to switch on the microscope light when you need to insert the instrument into the eye, and then sometimes under mesopic conditions or when the light is off, it's difficult to insert the instrument through the small trocar cannula, which is either 25 gauge or 27 gauge. So this is the problem statement. 3 ports, you switch off the microscope light, bring in the biome, switch it on again if you want to do an instrument exchange. So you need to switch on, switch off, switch on, switch off. So constant illumination was not possible, and so we need, because the light needed to be repeatedly switched on and off. So this was our problem statement, and so with this we devised this small instrument called as a Gloport. So this was to evaluate the real world experience of VR surgeons utilizing the Gloport, and we told them to include in your standard VR practice surgery and note down the time, whether you can increase your speed of surgery and whether you can increase your speed of instrument exchange. So this is how we do it. So this is a 3D printed device. You fix it onto your trocar cannula there, as you can see. Before you start the surgery, this is you can completely ETO it, and then you insert it into your tube, into the 2 ports. You can insert it in a 3-port PPV, and then you shine your endo-illuminated light for around 10 seconds onto the the device there. You can start your vitrectomy, and with the left hand you can just shine your device, and then in mesopic conditions or in dim roof conditions, this starts glowing. So these are your illuminated vitrectomy trocar cannulas. You can be used under mesopic conditions. So we distributed this to around 7 vitreoretinal surgeons. So this was a retrospective multi-center feedback-based study involving 7 VR surgeons who utilized this Gloport in their surgical practice over a period of 1 year. And we had told them to note down the task completion time or evaluating the surgical videos on whether there's a reduction in the time taken to change the instruments, and also their feedback. So we gave them a feedback questionnaire, which was the aggregated quality score, and we asked them to score very poor, acceptable, or excellent, and 5 parameters gave them: visualization and precision, safety and complication prevention, ease of use and ergonomics, durability and reliability, and also the cost versus the benefit. So each category was rated 1 to 10, and then multiplied each category score by the weight percentage, and then we got the final score. So 7 VR surgeons utilized the Gloport over 200 patients in a period of 1 year, and then this was the score: visualization and precision around 9, safety and complication around 8, ease of use and ergonomics 8, durability and reliability around 7, and cost versus benefit around 8. So this was a final AQS score of 8 out of 10. So the main thing what they said, that there is definitely a reduction in mean time to task completion. However, this can only be measured under controlled environment or a lab environment, not in the real world. And the major advantage which they said was that there was no repeated switching on and off of the microscope light which was required. So there are a couple of limitations. So one is surgeries requiring a superior conjunctival manipulation or a scleral tunnel entry. You cannot combine those surgeries when you're using this Gloport, but we are working on reducing the diameters. And also the time comparison required for an instrument exchange with and without Gloport is ideally required under controlled mesopic or a lab settings. So to conclude, so Gloport is a 3D printed, frugal, inexpensive, reusable tool which improves the surgical efficiency by improving the instrument exchange. It reduced the ocular touch errors and reduced the procedure time. So this was a subjective feedback from VR surgeon, highlights its potential to enhance the visualization, and it's also beneficial for both experienced VR surgeons as well as new VR surgeons. Thank you.
So that's a good innovation. What is it made up of that it starts?
So it's a 3D printed material which is polylactic acid, and the bioluminescent material is strontium aluminate. It's inert, totally non-bioreactable, and it's used in those glow-in-the-dark sticks and rings. So that same material, it's a filament which comes, and we have incorporated into 3D printing into this.
So we don't need to on and off the microscope again and again to see the ports.
Yes.
And what's the cost?
50 rupees for piece of 2.
Oh, so where is it available?
Yeah.
It's available?
It's available with us, and we are in talks with Pricon, but nothing has been fruitful as of now. But so we are 3D printing it and kind of distributing it.
What's the name of the institute?
Sorry, Amita Eye Care in Kerala.